Dr. Linda Park here. Today I want to talk to you about cranial strains. Now that's an interesting term that probably no one thinks about on a regular basis. But we're going to talk about the bones of the cranium and their impact on dental health and whole body health. So the first thing I want to share is that there are 8 bones of the actual skull, and then there are 14 bones of the face. So that's a total of 22 bones. And as you can see here, maybe you can, there are sutures. Each bone is connected to another bone by a suture. And these sutures, at one time we used to think they were fused in adulthood or as we get older. That's not true, we've discovered. There's only one set of bones, and that's the spheno-basilar suture right in the middle of the skull, behind the mouth, and in the center, that's actually fused. And that fuses, we believe, at puberty. But the rest of these bones are not fused, which means they're movable. So the beautiful thing about it is we can manipulate them and cause changes that are helpful, because sometimes things get stuck. And when they're stuck, that's what a cranial strain is. So it's a permanent asymmetry of the bones of the cranial vault and face that can result from a long-term strain originating from birth or childhood. And so some of the common causes of cranial strains can be a physical trauma. Maybe you fell. My son, when he was just 2 years old, landed on a bucket right here on his nose. So that can introduce trauma that stays with us. It can be an accident, it can be a blow to the face, or it can even be position in the uterus of the mom. So there are a lot of causes for that. Mental trauma can cause cranial strains. Chronic tension, muscle tension causes cranial strains. I personally have a tight left side, and so I have a temporal bone here that's a little bit malpositioned, which causes this muscle to get tight, and it creates all sorts of problems. I'll go into that later. And then just dental malocclusion. So the way that my teeth fit together actually affect the bones of the cranium, because this other connection here, the TMJ, functions as a result of the way the teeth fit together. And if you have one tooth hitting harder here than it does on this side, what's that going to do to the bone of the bones of the maxilla? And what's that going to do to the temporal bone? So there's a whole bunch of things that can happen as a result of a cranial strain. And when they're present, they interfere with a person's ability to achieve optimal health by compromising the natural ebb and flow of their cerebrospinal fluid in the brain and spinal column, and also lymphatic flow. Because when things are going on inside the cranium that are stressful from a stressful thought, those things travel down into this area and they get clogged and congested, because there's the gliolymphatic system in the brain, and that drains into the lymphatic system. So that's a whole nother topic. I've discussed it before, the importance of lymphatic flow, but it's all connected. So what we know is that the cranium affects so many things, and our thoughts affect so many things, and our physical trauma and modern living, it all comes together to create these situations of unhealth that people struggle with all the time. And sometimes these cranial strains can result in aberrant or defective growth. People may have, their faces are distorted a little bit. It can be as mild as, like in my case, I have an internally rotated maxilla. So the shape of my upper jaw is like this, and on this side, and like this on this side. So what that caused for me after braces was TMJ problems on my left side, because this forced this over and created a situation of discomfort for me. About a year ago, I was struggling with just eating comfortably because of this, and it was a situation where it was painful to open wide, to chew. So now I actually have an appliance that I use to expand and bring forward my upper jaw. So having these cranial strains can cause airway problems, sleep issues, headaches, TMJ problems, as I said, incorrect growth for people down the road. So lots of contributing factors to the body. It also affects posture and can make you imbalanced in many various areas throughout the body. Thank you so much for taking time to watch this video. I hope you found it helpful and informative for living a healthier life. If you did, hit like and subscribe and wait for more great content.